Hello, this is Dr. Jeanette Miller, and in this module today we are going to be talking about hearing technology. Our goals for this module is for you to know the difference between a hearing aid, a cochlear implant, and an osseointegrated processor, auditory processor. We also want you to know the criteria for use of a hearing aid and a cochlear implant. And we also are going to talk about the specialized hearing technology that helps an individual hear in noisy situations and also in daily connectivity activities such as talking on the phone or listening to TV or music. But before we can talk about technology, you have to understand hearing and why a certain technology will work with a certain type of hearing or hearing loss, actually. There are 4 parts to the ear. There is an outer ear, a middle ear, the inner ear, and the auditory centers of the brain. Understanding how we hear helps us understand how hearing technology can help those who have a hearing loss. The sound is directed down the ear canal and it hits the eardrum, which changes it to a vibration which moves through the 3 bones to the sensory organ in the cochlea. Inside the sensory organ are hair cells that are aligned from high pitch to low pitch. These hair cells, when struck, fire and send the sound up the nerve to the brain to be understood. Many times, the most common hearing loss is sensorineural hearing loss, which affects the cochlea or the snail-shaped organ that you can see on this slide, where those hair cells are arranged like a keyboard from the high pitches to the low pitches. These hair cells are very important for hearing and understanding speech, which is very significant in a sensorineural hearing loss, which we are going to talk about in a moment. The different types of hearing loss, as I mentioned, one is sensorineural hearing loss. The next is conductive hearing loss. We can have a mixed hearing loss, which is a combination of the two, or a neural hearing loss, which affects the nerve. A conductive hearing loss does not allow the sound to be transferred from the outer ear to the sensory organ. In a sensorineural hearing loss, the sound can get through the outer and middle ear, but the sensory organ is not as sensitive and cannot send the sound to the nerve as efficiently as possible. In this slide is a representation of a sensorineural hearing loss. What happens are those hair cells in the cochlea become damaged and they no longer are as sensitive to as soft a sound in different pitch areas. So that affects how well the keyboard sends the sound up to the brain. This is important when we're talking about technology options and what is appropriate for different types or levels of hearing loss. A hearing aid is a tiny electronic device that sits in or behind your ear. It can be fitted to an ear as early as 6 weeks of age, but it does rely on the functioning of the cochlea to transfer the sound up to the nerve to be sent to the brain to be understood. Hearing aids usually work well for hearing losses up to 60 to 70 dB HL, and they can still provide limited access to speech and sound for hearing losses greater than 70 dB. So how does the hearing aid work? The hearing aid has a microphone or 2 that picks up sound in the environment and sends it to the computer on the inside, where it is converted to an electrical signal. That electrical signal is adjusted or changed according to a client's hearing loss. So if they hear better in the low pitches but have more hearing loss in the high pitches, when a high pitch sound comes in, it's going to give more volume or gain to that high pitch sound but not touch the low pitch sound at all. And then that hearing aid converts the sound back to an acoustic sound that travels down the ear canal to the eardrum, to the sensory organ, and up the nerve to the brain to be heard. Now, when the brain hears it, it understands it as speech. It is pushing sound through the cochlea where the damage has happened. The hearing aid will also work for conductive hearing losses as well as sensory neural hearing losses. There are two parts to a hearing aid. There is the computer part, and that's the part that sits behind the ear. It's the electronic part. And then you also have the ear mold part. It's the part that takes the sound, directs it down the ear, and also holds the hearing aid on the ear. So those two pieces go together, and they're one piece. The microphones are on the hearing aid. They pick up the sound. They are located here and here. They pick up the sound, direct it into the computer, and the computer makes the changes according to your hearing loss, and then the sound comes out down the tube and into your ear canal, and it highlights those pitches or frequencies that you do not hear well. And that is how the hearing aid works.
Show the battery.
Oh, I don't have a real one.
That's okay. Just show the one.
To turn a hearing aid on and off, there is usually a battery door here. It will open up to turn it off, and then you close it in order to turn it on. They've eliminated a lot of switches to keep things from breaking down. You can also have a volume control on the back of the hearing aid. For most children, we turn the volume control off because we want it to work in automatic. It adjusts as it goes into different listening environments for that child. But some adults do still like to control how loud their hearing aids are, and we can give them that volume control. Also, on the pediatric hearing aid, you will also see a light that flashes on the back, and that lets the parents know if the battery is still working, especially if their child cannot tell them if the battery has gone dead or not. For adults, there's an alarm, an audible alarm in the computer that will let the wearer know that the battery is about to go dead, so that they'll know to go get some batteries and change it. So, what makes someone a candidate for hearing aid use? An identified hearing loss of greater than 20 decibels, 25 decibels, no medical contraindications. This hearing loss is not surgically or medically treatable, and all types of hearing loss can benefit from a hearing aid. The exception is neural hearing loss, which sometimes notice some benefit from hearing aids. It really depends on the person. But the hearing aid definitely has limitations. For a severe or profound hearing loss, there's not enough information being amplified or transmitted through the cochlea to the nerve to understand the signal. So the potential difference is that potentially the hearing aid cannot make sound loud enough. If it's a very soft S sound, it takes a lot of power to make it audible to an ear that has severe damage to it, and it may be impossible. The system may also be sending that sound through with significant distortion due to the amount of hair cell damage, because the hair cell damage, or the hair cells, give us the fine tuning of the sound that is sent up to the brain. And if large areas are damaged, then it's like a piano with broken keys, and the music is not the same when it reaches the brain. So this is why we start talking about a cochlear implant, because cochlear implants send the sound to the brain differently. It provides a more direct connect to the to the nerve by replacing the sensory organ where the damage has happened. So, how does a cochlear implant work? Well, a cochlear implant consists of two parts. You have an internal part that is surgically implanted in the ear, And then the external part is the processor that picks up the sound, communicates it to the internal part so that it knows what to do. So as we take a look at this picture, we can look through the system and see how it works. At number 1, that is the processor on the outside picking up the sound and changing sound to a digital signal. The digital signal is transferred from the coil, the brown piece, to the internal piece through radio frequencies. The external piece is held in place with a magnet so that it can communicate with the internal piece. The internal device has an electrode array, which you can see in the blue portion of this picture, which is the cochlea. Those electrodes are associated with different pitches. So if a low pitch sound comes in, the low electrodes are stimulated and send an electrical impulse to the nerve, which is then taken up to the brain to be interpreted by the brain. Now, a cochlear implant is different from a hearing aid. A hearing aid is just taking sound, making it louder, and pushing it through the hearing system. But with a cochlear implant, there's actually a surgical part where they implant an internal piece that takes the place of the cochlea, or it takes, that's not right. They surgically place a piece underneath the skin, and there's a coil here with electrodes on that goes into the sensory organ, the cochlea, and it has a connect so that it can connect to the nerve to send the sound up to the brain. So that way you're not trying to force the sound through the system. You're actually replacing kind of the broken part of the system. So, but in order for the internal part to know what to do, so this is placed surgically, and then 2 to 3 weeks later, a child or an adult comes in to have the outside programmed in order to talk to the internal piece and tell it what to do. The processor has microphones that pick up the sound just like a hearing aid, and it sends it into the processor part, the computer part. It knows how much power it needs in order for the internal piece to talk to the nerve in the body. This is the battery pack on the bottom that gives it the power to run, and then you have a coil that sits on the head. This connects to the internal part via a magnet, and you'll see this sitting on the side of the head. And then radio frequencies are used to pass the information from the processor to the internal piece to tell it what to do. As the sound comes in, that processor knows how to tell exactly the internal piece what to do. So how is a cochlear implant different from a hearing aid? The hearing aid picks up sound and makes it louder, but still pushes it through the cochlea, which has the hair cells that are damaged or broken or not working as efficiently as they should be to get the sound to the nerve. And as we know, sometimes some sounds won't make it through. For a cochlear implant, the internal electrode array actually replaces the damaged sensory cells that are not able to transmit that sound to the nerve. So then the cochlear implant is able to better represent all of the speech frequencies for the person who is listening through the implant, because of that direct connection with the auditory nerve makes that message much clearer that reaches the brain for interpretation. So who is a candidate for a cochlear implant? Primary candidacy is if you're between the age of 12 to 24 months, a profound hearing loss across the pitch ranges from 250 to 8,000 hertz. Greater than 24 months, you can have a severe to profound hearing loss, which you can see from 70 to 120 dB. But what we need to have is that you demonstrate need that hearing aids are not providing enough information for either a child to develop speech and language or for an adult to understand speech in over 50% of the time. We also look to make sure there are no medical contraindications, such as the cochlea is fully formed, there is not anything that would block the insertion of that electrode array. To move on to a different processor, let's talk about the bone conduction processor called the Osseo Integrated Auditory Processor, also known as the BAHA. The Audio Integrated Processor is used for children or adults who experience either atresia of the outer ear canal, meaning it's closed and there is no way sound can proceed to the cochlea through the ear canal, or for those who have discontinuing of the ossicular chain, which means the three bones in the middle ear are not touching each other in order to transfer the sound to the sensory organ. Also, adults or children with permanent hearing loss on one side but normal hearing on the other side can also benefit from an osseo-integrated auditory processor. The surgery is not approved until children are of 5 years of age or older, and they have a certain density of a bone in order for the abutment to sit into. So children under the age of 5 can wear the processor on a headband, and the processor just needs to sit where the sound can be transferred through the bone. So that can be on the forehead or on the behind the ear, but anywhere that it has good contact with bone. For adults or anyone who has the surgery, there are two choices. You can do the abutment, which is a post in which a screw, titanium screw, is placed inside the bone, and the bone grows through the screw to anchor it in the skull. And then the processor can snap on and snap off. The other option is there's a magnet plate that is implanted under the skin, and then the processor is able to connect to the magnet plate and transfer the sound through through vibration as well too. So here is how it works. The processor picks up the sound and converts it into vibrations, which is communicated to the skull bone, and it travels through the skull bone to the cochlea. Those vibrations or sounds do not have to travel through an ear canal or through the middle ear bones in order for the sensory organ to pick it up. The sensory organ, which in atresia or a conductive hearing loss, is functioning normally, and then so once the sound reaches, it is able to transmit those vibrations into electrical signals that the brain can understand. For single-sided deafness, the sound is actually transferred to the other side of the head to the normal functioning cochlea, and the sound is then taken up to the brain to be understood. But it allows a client to have localization skills and speech understanding on that side of the head. So who is a candidate for an osseo-integrated processor technology? Those who have conductive hearing loss, especially associated with atresia or persistent drainage from the ears, such as associated with cholesteatomas or just ear infections that cannot be resolved. Also single-sided deafness, which we talked about. And for surgical, they must be 5 years of age or older. Those are the general processors that allow a person to hear in all of the environments they walk in and out of. But we consider those general purpose technology. They're used for every day. But there are certain listening situations or environments that are difficult for the processors or the technology to really provide the clearest speech understanding for a person who has a hearing loss. So there are specialized access technology that we use to help children hear better in classrooms, adults hear better in meeting settings, because we have to reduce the signal to noise ratio, which means the signal, the speaker, compared to how much noise is in the background. Children with a hearing loss need a plus 15 signal to noise ratio to understand in the presence of background noise. This means most of our classrooms are too noisy, even with a child sitting on the front row, to be able to hear and understand their teacher through all teaching situations. Adults also will tell you that in meetings, this affects them greatly. These pictures give you a visual representation of what a person with hearing loss hears. The first picture is the teacher is saying fire truck in the middle of all the other noise going on, and it all blends together when you have a general purpose hearing aid on, whether it's hearing aid, cochlear implant, or an Osseo integrated auditory processor. If you move closer, the fire truck starts to stand out, but there's still a lot of background noise. With use of the specialized technology, such as an FM system, whether it's personal or classroom, the fire truck word comes out of the background noise and can be understood with clarity. So what are the different technologies? We can break the technologies into 4 different categories. There is, which can be either personal, which means that it is easily carried around and used in many different settings, or classroom-based, which means it would stay in the classroom or in a facility where it is set up. We have FM, which is frequency modulated technology. We have DM, which is digital modulation technology, which is the newest technology that has come out, and it works on a gigahertz wavelength. There's also infrared, which you would be most familiar with your TV remote, works on an infrared signal. It remains in the room that it is presented in. And the final is loop systems, which work through using magnetic fields to transmit sound to hearing devices. How does this technology work? These all work very similar. They just transmit it to the receiver or the hearing aid differently. Each one has the speaker wearing a microphone, which is then transferred to a receiver. On a personal system, the receiver is at ear level on the hearing aid, the processor, or the Osseo integrated auditory processor. And therefore, this system can move with the person as they go in and out of different environments, because it is connected to their personal amplification, whether it's a hearing aid or a cochlear implant. Infrared systems are more typically desktop speakers or classroom sound field speakers that allow the sound to either sit with the student while they are at the table, or it will transmit across the classroom and benefit all listeners in the classroom. The loop system, which uses magnetic fields, also is a classroom-based system, or so public places such as theaters and churches use this and the magnetic field presents the sound that the hearing aid or the processor picks up through their T-coil. But those don't travel with you in a personal way. What these systems do is take the teacher's voice and transmit it directly to the receiver, which is almost like the teacher is standing right next to you, which increases that signal to noise ratio to levels that are acceptable for understanding speech and noise. So the final connectivity device that we are going to talk today is more personal and probably the least expensive of them all, and it helps people with hearing loss connect to all the media things that we enjoy today, such as TV and iPad and phone and computers and Xbox. So many times those are associated with headphones and is left individuals with hearing loss out of the picture, because if they put headphones over their hearing aids or their processors, it either causes feedback or whistling, or it's very uncomfortable and it's not a clear signal. But the technology today allows streaming, so there is a device that will now pick up Bluetooth signals coming from the iPad or the phone. You can pair them, and then the streamer will send the information to the hearing aids wirelessly or to the processor wirelessly, so that hearing aids or the processor become the headphones for a person with hearing loss. You can talk on the phone as a wireless hands-free, just like you would if you had the piece that was sitting in your ear. What's also wonderful about that is that a person with hearing loss can actually hear the message in both ears, which improves their hearing understanding. These devices are called streamers, and each company has the one that would work with their particular amplification device. Not only does it work with Bluetooth, but there's also a cord that allows them to plug into any headphone jack. So even if it's not a Bluetooth device, if it has a headphone jack, these streaming devices would allow access, and their hearing aids be their headphones for them. This concludes the technology information module, and we are going to have a couple of questions to check your understanding. Question number 1. Name the parts of the cochlear implant system. External processor, internal device. What is an appropriate amplification for a moderate sensorineural hearing loss? Hearing aid. What is improved through use of an FM system? Signal to noise ratio. Thank you and have a great day.